Hey everyone, welcome to Dodo Lanjar. So, let's talk about something that's, unfortunately, a huge problem for a lot of people: healthcare costs in the US. If you're living here and don't have health insurance, managing medical expenses can feel like trying to navigate a labyrinth blindfolded. It's stressful, it's confusing, and it can feel downright impossible sometimes. But don't worry, that's what we're here for. In this video, I'm going to walk you through, step by step, how to reduce your healthcare costs, find more affordable treatment options, and hopefully, avoid that dreaded medical debt in 2025. Make sure to watch all the way to the end, because I've got some secret tips and tricks that most people don't even know about. Okay, so before we dive into the strategies, I think it's important to understand why healthcare costs are so high in the US in the first place. I mean, we're talking about one of the most expensive healthcare systems in the entire world. Think about it. An average trip to the emergency room can set you back anywhere from $1,200 to over $3,000. Just a regular doctor's appointment can cost between $100 to $300. And don't even get me started on hospital stays, we're talking $10,000 per night. Surgery? Well, that can range from $20,000 all the way up to like $100,000 or more. It's insane. And without insurance, these expenses can snowball into some serious financial problems faster than you can say copay. It's a system that often feels designed to keep people trapped in debt. But, and this is a big but, don't despair. There are ways to navigate this system even without insurance. We're going to talk about how to minimize those costs, negotiate those bills, and find affordable care. Because everyone deserves access to healthcare, regardless of their insurance status. It's about advocating for yourself, understanding your options, and knowing your rights as a patient. And that's what this video is all about, giving you the tools and knowledge you need to take control of your healthcare journey. So let's move on to some immediate steps you can take if you need medical care right now. We'll cover how to find the best healthcare providers in your area, and what questions to ask to ensure you're getting the best care possible. We'll also discuss how to compare different healthcare plans and what to look for in terms of coverage and costs. Plus, we'll explore some digital tools and apps that can help you manage your healthcare more efficiently. By the end of this video, you'll be better equipped to handle the complexities of the US healthcare system. Alright, so you're in a situation where you need medical care and you don't have insurance. It's a stressful scenario, but don't worry. There are steps you can take to manage this. First of all, don't panic. Take a deep breath and try to stay calm. Panicking will only make the situation feel more overwhelming. There are things you can do to make the situation less stressful and less expensive. Planning and knowing your options can make a huge difference. The first thing you should always do, and I mean always, is ask for a cash discount. This might seem unusual, but it's a common practice. You might feel weird asking, but trust me, it's worth it. Many people don't realize that this option exists, but it can save you a lot of money. Many hospitals and clinics actually offer discounts, sometimes significant ones, like 10% to 50% off, if you pay for your treatment in cash. This is because it saves them the hassle and fees associated with insurance claims. Don't be afraid to be direct. Just ask, do you offer a self-pay discount? You'd be surprised how often the answer is yes. You'd be surprised how often the answer is yes. Next up, negotiation. This might sound daunting, but it's a powerful tool. I know it can feel intimidating, but hospitals often overcharge for services, and negotiating your bill can potentially save you a ton of money. It's worth the effort. We're talking 30% to 70% reductions in some cases. That's a significant amount of money that stays in your pocket. Start by requesting an itemized bill. This breaks down all the charges so you can see exactly what you're paying for. It's a crucial step. This breaks down all the charges so you can see exactly what you're paying for. Check it carefully for any errors. Billing mistakes are more common than you might think. Check it carefully for any errors. Billing mistakes are more common than you might think. Then, do your research. Knowing what you should be paying can give you leverage. Websites like fairhealthconsumer.org can help you determine fair prices for medical services in your area. This information is invaluable when negotiating. Armed with this information, you can negotiate with the hospital's billing department. Be polite but firm, and don't be afraid to ask for a reduction. And here's a big one. Whenever possible, opt for urgent care centers instead of emergency rooms. This can make a huge difference in your medical bills. ERs are notoriously expensive, while urgent care centers offer many of the same services at a fraction of the cost. It's a smart choice for non-life-threatening issues. We're talking about the difference between a $1,500 plus ER visit and a $100 to $300 urgent care visit. That's a massive saving. Of course, if it's a life-threatening emergency, get to the ER immediately. Your health and safety come first. But for less severe situations, urgent care is a much more budget-friendly option. It's a great way to get the care you need without the hefty price tag. Remember, knowledge is power when it comes to healthcare costs. The more you know, the better you can manage your expenses. By being proactive, asking the right questions and exploring all your options, you can significantly reduce your expenses and get the care you need without breaking the bank. It's all about being informed and prepared. Speaking of affordable options, let's explore some ways to find medical services that won't drain your bank account. There are resources out there to help you. Okay, so we've talked about some immediate steps to take when you need medical care, but what about finding affordable healthcare options in general? This is a crucial topic because healthcare costs can be overwhelming, and knowing your options can make a significant difference. The good news is, they exist. Yes, there are several avenues you can explore to find affordable healthcare. You just need to know where to look. It might seem daunting at first, but with a little guidance, you can navigate through the options available to you. First up, let's talk about community health centers. Many cities and towns have these clinics that offer free or low-cost healthcare services to those who qualify. They provide a range of services from general checkups to specialized care. They're a lifesaver for so many people, especially those who might not have insurance or are underinsured. You can find a community health center near you by visiting findahealthcenter.hrsa.gov. This website is a valuable resource for locating nearby clinics. Seriously, bookmark that website. It could be a game changer for you or someone you know. Next, look for sliding scale clinics. These are amazing because they adjust their fees based on your income level, making healthcare more accessible to everyone, ensuring that everyone can access care regardless of their financial situation. This means that even if you have a lower income, you can still receive the medical attention you need. You can often find sliding scale clinics by searching for federally qualified health centers or FQHCs in your area. These centers are designed to serve communities with limited access to healthcare. Don't underestimate the power of medical charities and programs. Organizations like Remote Area Medical, or RAM, travel around the country offering free medical, dental, and even vision care to underserved communities. It's incredible. They set up temporary clinics and provide essential services to those in need. Other charities like the Healthwell Foundation, Needy Meds, and the PAN Foundation provide financial assistance for specific medications and treatments. These organizations can help cover costs that might otherwise be unaffordable. And then there's medical tourism. I know it sounds extreme, but hear me out. Medical tourism is when people travel to other countries to receive medical care. Some people actually travel to other countries like Mexico, Canada, or India for certain medical procedures because it can be significantly cheaper even with travel expenses factored in. This can be a viable option for those facing high medical costs, even with travel expenses factored in. It's important to do thorough research and ensure the quality of care in the destination country. It's definitely something to research and consider, especially for more expensive procedures. Make sure to weigh the pros and cons carefully. The key takeaway here is that affordable healthcare options do exist, even without insurance. It might take a little more research and effort on your part, but the benefits are worth it. Finding the right option can save you a lot of money and stress. But trust me, it's worth it to protect your health and your finances. Taking the time to explore these options can lead to better health outcomes and financial stability. Now let's move on to a topic that's a major expense for many people. Prescription medications. Okay, let's talk about prescription medications. We all know how expensive they can be, especially if you're paying out of pocket. But don't worry, there are ways to save money on your meds without sacrificing your health. First and foremost, take advantage of discount apps and websites. Seriously, these things are game changers. Websites like GoodRx, Blink Health, and SingleCare allow you to compare prices from different pharmacies in your area and find the lowest cost for your medications. You can often save a significant amount of money just by shopping around. Next, don't be afraid to ask your doctor for generic medications. Generic drugs have the same active ingredients as brand-name drugs but are often significantly cheaper, sometimes up to 90% less expensive. There's really no reason to pay more for the brand name if a generic option is available. And here's a big one: apply for prescription assistance programs. Many pharmaceutical companies offer programs that provide free or low-cost medications to eligible individuals. These programs can be a lifesaver if you're struggling to afford your medications. You can usually find information about these programs on the pharmaceutical company's website or by asking your doctor or pharmacist. Remember, managing your healthcare costs without insurance can feel overwhelming, but it doesn't have to be. By being proactive, exploring your options, and advocating for yourself, you can access affordable healthcare and medications without sacrificing your financial well-being. So, that was a lot of information, but hopefully, you found it helpful. Navigating the US healthcare system without insurance can feel like trying to solve a Rubik's Cube blindfolded, but it's not impossible. Remember, you're not alone in this. Millions of people are facing the same challenges and there are resources available to help. Don't be afraid to ask for help. whether it's from a medical professional, a financial counselor, or a trusted friend or family member. And most importantly, take care of yourself. Your health is your most valuable asset, and it's worth fighting for. Stay informed, stay proactive, and stay healthy out there. Are medical bills giving you sleepless nights? The stress of mounting medical expenses can be overwhelming, but don't lose hope. You're not alone. And today, I'm here to share some tips that can help you manage those daunting expenses. Together, we can find ways to ease the burden. Let's dive right in. First up, you can negotiate a payment plan with your hospital. Most hospitals are pretty flexible and will let you pay in installments with no interest. This way, you can break down a big bill into smaller, more manageable payments. It's important to communicate openly with the billing department. They often have programs in place to assist patients in financial distress. This way, you can break down a big bill into smaller, more manageable payments. It's a practical approach that can make a huge difference. Next, don't shy away from applying for financial assistance, also known as charity care. Nonprofit hospitals are actually required to provide financial assistance to low-income patients. This could significantly reduce your bill, or even eliminate it altogether. Imagine the relief of having a major portion of your medical expenses wiped out. Another option to consider is using medical credit cards like Care Credit or Access One. These cards allow you to pay your bills over time with no interest, at least for a limited period. Just be sure to read the fine print to avoid any unexpected charges later on. Understanding the terms can save you from future headaches. If you're dealing with a particularly hefty bill, think about hiring a medical bill advocate. Services like Coplax, $4, or Resolve Medical Bills specialize in negotiating with healthcare providers to lower your bill. It might cost a bit up front, but the savings could be worth it. These professionals know the ins and outs of medical billing and can often secure significant reductions. Now, let's talk about some long-term solutions for healthcare without insurance. First, explore short-term health plans and Medicaid. Short-term health plans can provide low-cost coverage for temporary needs, and Medicaid offers free or low-cost healthcare, though eligibility varies by state. Another alternative is health-sharing programs like MediShare or Liberty Health Share, which pool resources among members to cover medical costs. Also, look into employer-sponsored health benefits. Believe it or not, some part-time jobs offer health benefits. Companies like Starbucks, Amazon, and UPS provide health insurance to their part-time employees. It's worth exploring these opportunities if you're in need of coverage. Alright, to wrap things up, managing medical expenses without insurance is tough, but not impossible. Take advantage of cash discounts, negotiate your bills, visit low-cost clinics, and use prescription savings programs. These strategies can collectively make a significant impact on your financial health. If you found this video helpful, please like and subscribe for more financial tips. And comment below, what healthcare challenges are you facing in 2025? Let's discuss solutions together. Thanks for watching and take care.